Hi, I'm Mwenda Phiri. I'm 15 years old and I live in Cape Town, South Africa. I love acting and I also love music and community service. I am the current vice president of my school's Interact Club. My school is Parklands College. I have sickle cell anemia, also known as sickle cell disease.
Sickle cell disease is a genetic disorder, which means that you're born with it. Sickle cell disease happens in the blood. What happens is when red blood cells are under certain conditions, they start to sickle. And what that means is they start to turn into like a banana shape. And when this happens, they start to stick to each other, which blocks arteries and veins, and it can cause a lot of pain, nausea, and also can make you feel weak. This is called the sickle cell crisis.
We've been really fortunate because Mwenda has not experienced a major sickle cell crisis leading to hospitalization since he was 3 years old. He was diagnosed at 9 months by my late grandfather, Professor Chintu, and early detection is really important because it can really help parents equip themselves to manage the disease and to prevent crisis. Mwenda is a typical teenager. He has an active social life, he likes to party, he loves to hang out with friends, he loves to travel, and he definitely does not allow sickle cell to define his life.
But last month, I had a severe crisis that put me in the ICU for 8 days.
When we got to the hospital, it was very scary because he wasn't moving at all. He was unconscious. And they took him into the room, and I was there as well. And then they told me to go out. So I got very sad because I didn't know what was going on.
The time that Mwenda was in ICU was the hardest experience I've ever gone through. It was the hardest experience for us as a family, sitting there, waiting, completely helpless and waiting for the doctors to do their work, for the nurses to do the work, and for the medication and the equipment to help him. It was really, really difficult.
It was just a very, very difficult time for all of us. And I wouldn't want to imagine what would have happened if we were in another place without the facilities that we have here.
During my stay in hospital, I learned that many hospitals in other African countries do not have life-saving equipment for children. There's a great shortage of life-saving equipment such as oxygen machines and incubators, and sometimes even basic equipment like baby bassinets are in short supply. Because of this, we started the Mwenda Phiri Initiative in service of children's health. MPI raises awareness and funds for paediatric, haematology and ICU in Africa.
It's amazing that Mwenda took such a very difficult experience and turned it into something positive, and thinking of other children who don't have access to the facilities that he had access to. He's an amazing child and we'll support him.
So, I'm really excited to announce that for our first fundraiser, we will be raising funds for equipment for a hospital in Zambia. Please support the children by making a contribution of any amount and also by sharing the campaign. Your contribution might save a life.